and feverish illness are very common in young children, particularly in those aged less than 5 years. And it can be really worrying for parents. It's not always easy to judge how sick your child is, whether you should ask for medical help. 3 to 4 out of every 10 parents or children aged less than 5 years say that child has had a fever in the past year. It is probably the most common reason for a child to be taken to the doctor. Fever is also the second most common reason for a child being admitted to hospital, and it can be a cause of great anxiety in parents. Understanding how best to manage a fever, knowing when to seek professional help or advice, knowing what signs suggest that your child may be seriously unwell, including how to check for signs of lack of fluid in the body, also known as dehydration, and other signs of serious illness will form part of our discussion in today's topic, fever in children, tips for mothers. It's another day with the physicians where your health is our business. Today we'll be discussing a topic that is very close to my heart. We're discussing fever in children, tips for mothers. My name is Dr. Martina Agbere, usual anchor on this program. And in the studio, we have our guest. She is a consultant pediatrician and also a pediatric cardiologist. She is the MD, CEO, Excel Children's Hospital, Dr. Chinyere, Uzodinma. Doctor, you are welcome, sir.
Thank you, Dr. Martina. It's my pleasure to be here.
Thank you. You're welcome. So what we'll be discussing, fever in children, tips for mothers. Tips for mothers.
Yeah.
Because you know a lot of fever. Oh, my child is running the temperature, my child is doing this, my child has this, she's teething, there's a fever. So now let us discuss it.
Dr. Martina, I'm just wondering how we're going to take up this topic in this piece of time.
Okay. So maybe if I first start with it, why does fever actually happen?
All right.
Maybe the physiology?
Okay, now, first of all, I want to begin by saying that fever is a symptom. Fever is also a sign of an underlying disease. Fever is not a diagnosis. That's number one. Fever can be looked at in two ways. Medically, directly, an increase, a rise in body temperature above the normal. And what is the cutoff for normal body temperature? Body temperature greater than 37.3 degrees Celsius is considered as fever. The other way, fever, because I'm talking to families now, when the child's body is hot, that is fever. In other words, when you touch your child's body and the temperature of your hand compared to the temperature of your body indicates hotness of the body, that is fever. I have to stress it because sometimes people say, my child is having malaria. Fever and malaria are not the same thing. Fever just means the body is hot. That is fever. So having said that, I would like to talk about when there is a fever, what does it mean? Okay? Now, when there is a fever, we'll look at it in three different ways that are important for people who are listening. We will look at it in terms of the grade of the fever. So there is fever that is characterized as low grade, and there is fever that is characterized as high grade. When a fever is low grade, it means that it is above 37.3, but it is less than 38 degrees Celsius. Once a fever is 38 degrees Celsius and above, we consider it as high-grade fever. Why is it important? High-grade fever is more worrisome than low-grade fever because the causes of low-grade fever are different from the causes of high-grade fever. And also, complications arising from fever would come up when you have high-grade fever than when you have low-grade fever. And that very important complication is what we call febrile convulsion. Now, having talked about the grading of the fever, it's also important to talk about the continuity or the trend. In other words, is it a continuous fever? A fever that stays there continuously, even when you give antipyretic. When I say antipyretic, I mean common paracetamol and other drugs that can bring it down. Just after you finish giving it, it goes up again. It's a continuous fever. It's a sign that something is seriously wrong. Then there are fevers that are intermittent. They come in the morning, the child looks well. In the evening, the fever comes. And then it goes away again. You think everything is okay. And then it comes back. That is intermittent.
It has a rhythm.
Has a rhythm. That is intermittent fever. Now, having talked about that, it's important for us also look at fever in terms of who is being affected, because the age of the child matters. When a child who is under 3 months, 0 to 3 months, has a fever, it is a very serious symptom compared with when a child that is over 5 years is having a fever. Because fever in a newborn child is usually a sign of a serious underlying problem. And such a child under 3 months, for no reason should the mother wait at all. That kind of fever should go to the hospital immediately. No waiting, no delay. Now, we also look at fever in terms of beyond that 3 months old, in infancy, until 1 year, and then the toddlers, and then the preschool, and then the school-age children. When you look at fever for children that are under the age of 5 years, there are peculiar conditions that are usually responsible. And what are these peculiar conditions that are usually responsible? First among them is malaria, because we live in a malaria endemic environment. That's malaria. Then the next commonest cause of fever is the range of respiratory tract infections. When I say respiratory tract infections, I mean infections that are often contracted by droplets. So in other words, most of the causative agents exist in the air. They are airborne. So when children are sneezing, are coughing, they tend to share the organisms. And that is why that is the second most common cause of fever in children. Beyond that, and within that respiratory tract infections, like I said, is like a covering umbrella of conditions that include pneumonia, otitis media, tonsillitis, and a host of others. Beyond that, we have more serious causes of fever like meningitis and all that. Now, like I said, when a child is under 5 years, the particular most serious complication of fever, which is febrile convulsion, is likely in a child that is under 5. So fortunately, I would say, when a child is over 5 years, sometimes over 6 years, the likelihood of having a febrile convulsion drops. Therefore, fever should call for immediate interventions, particularly when children are less than 5. Because if you waste time, the child may begin to convulse. Okay. Now, having talked about that, the next thing that we have to talk about is when a child has a fever, when should the mother be alarmed? What should the mother do? And I will say, for every fever, the mother should be alarmed. Nobody should sit back in the house and say, I'm not worried, it's just ordinary fever. No, because you don't know what is causing it. Like I said in the beginning, fever is a symptom. Fever is a sign, it's not a diagnosis. And fever is not synonymous with malaria. And therefore, every fever has to be evaluated, diagnosed, and treated accordingly. Therefore, for every fever, I should advise that the mothers should go to the hospital.
For every fever, the mother is advised to go to the hospital.
Yes.
Welcome Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing fever in children, tips for mothers. And we have in the studio with me a consultant pediatrician and also a cardiologist for children. So we call her the pediatric cardiologist, Dr. Chinyere Uzodinma. She is the MD CEO of Except Children's Hospital here in Lagos. Dr. Uzodinma, again, I want to just say thank you because you actually have schooled us a lot on fevers, how to manage it. Before we went to a break, you told us the different parts, what should be done. So I want you to continue.
Yes, I think there's something I must say before we move forward. You know, I'd mentioned causes of fever. And I'm sure, Martina, Dr. Martina, you've noticed that I didn't talk about typhoid.
Yes.
Thank you. So I didn't forget it. Typhoid is not a cause of fever. It's not a common cause of fever in children. I must state it very clearly because, unfortunately, in this environment, people that think that fever is not due to malaria, it is due to typhoid. No.
Have you noticed that every lab that they go to come out with a diagnosis of typhoid?
So please, typhoid is not, if we start listing the causes of fever in children, it wouldn't make the list among the first 20. Not at all, as a cause of fever. Most of the tests that we roll out, you know, from many of these labs outside, they are very misleading. So let us just keep them aside. Now, going forward, I said one of the things we need to talk about is what are the things that indicate that fever may be due to a serious condition. The first of them, and in particular, we also have to put the age of the child beside it. Yes, because if a child is having a fever and the child is refusing to feed, particularly for neonates, when I say neonates, I mean newborn babies. You know, babies that are just under 3 months. They're having a fever, they're refusing to feed. It is like an emergency. The same thing with older children, less than 5 years. If they're having fever and they're refusing to eat, is a sign of a serious underlying cause. And why is it more important too? Because once they refuse to feed, there are other complications that will come up. The first of them is hypoglycemia. Their blood sugar will drop. And when the blood sugar drops, they can die from it. The second one is dehydration. When they stop eating, they stop drinking, they get dehydrated. The third of them is what we call extreme weakness. So when they are extremely weak, they refuse to eat, they refuse to get up. Those are signs that you should not wait for them to come up before you get to hospital. And Dr. Martina, that's why I said, when a child has a fever, take the child to the hospital immediately. You know, before my eyes, I've seen children that they woke up well in the morning. They have fever just after waking up, and then by evening, that child is gone. From what? Severe malaria. Because you don't know which malaria is severe. And you don't know how these illnesses can progress. So you just have a fever, 37.5, and then the temperature keeps rising, 38, 39. You're not doing something. Before you know it, the child begins to have a convulsion. You're rushing to the hospital. And if you're not close to a good hospital, only God knows what the outcome would be. And really, you know, I really sometimes have had to cry, you know, for children who just die from preventable causes.
Carelessness.
Yes, carelessness. So the second sign that there may be a serious underlying thing is if fever is associated with fast breathing or breathing that is associated with indrawing of the chest, is an indication that the child may be having pneumonia. And you know, Dr. Martina, when young children have pneumonia, it means that they are not able to deliver enough oxygen. And that not being able to deliver enough oxygen can be a cause of death that can happen suddenly, even before the mothers know what is happening. Another thing is when a child is having a fever and you notice convulsion. Now, there are some convulsions that are very overt, like the jerking, the hands. But there are some, the child just stretches like this, and then you see the eyes rolling up. So sometimes the parents don't know that this is a convulsion. No, they think it's only when it is like this. Sometimes it's just like this, and then sometimes it's just the upward rolling of the eyes. Particularly for younger children. You know, for smaller children, you may just see them, their eyes will roll up their eyes will turn like this or their head, but you don't see very obvious movements on the limbs. So that's another thing. I don't want to talk about loss of consciousness because it's a sign of a serious underlying cause. Because I don't even want the child to lose consciousness before the parents come. But I have seen parents too who wait in the house until these very bad signs come up. That's why I said once there's a fever, do the first things. And what are those first things? First, you have to try to bring the fever down. How do you bring the fever down? The most readily available thing is what we call exposure. Expose the body. Take off the clothing. It's not the time to go and cover the child. Now, a rigor happens before the temperature goes up, particularly when the children are over 1 year. Rigors, I mean, shaking like this. You know,
that's rigor.
Yes, that's rigors. When they're shaking like that, is a sign that the temperature is going up, is climbing. So when you're seeing that rigors, even though the body is not feeling that hot, it is going to be hot soon. And for children, once it climbs up, that is when convulsion also happens. So that rigors is a sign that you should do what? Expose the child, remove the clothing, and then get a tepid water. What do I mean by a tepid water? Tepid water is lukewarm water. Water that one can describe as neither hot nor cold. So you will get it by mixing hot water with cold water. When you now get that tepid water, please note that I said tepid, not cold water. Some mothers have had to carry their children to the bathroom, open the tap. Once you do it, if the temperature drops rapidly, the child will also convulse because of a rapid drop in the temperature. So you don't use cold water. So now when you have put that tepid water in a bowl, you get a towel. What you need to do essentially is to encourage heat loss by convection. So what do? You take that small towel, spread the water like a film on the exposed body. Remember, by this time the whole body is exposed. Spread it on the body. The towel. Then allow the water to evaporate. As you spread the water and the water you spread on the body evaporates, the body begins to cool. Usually when you do this, you will be able to bring the temperature down. Within about 30 to 40 minutes, the temperature will be coming down. But as you're doing this, you also need to give an antipyretic. The commonest antipyretic, which is also over the counter, and which I advise that every mother who have children at home should have and keep, is acetaminophen. I have to use acetaminophen because it comes in different brand names. The commonest brand name, like we know, is the paracetamol. But we also have Panadol. We also have different ones actually, but they're all antipyretics. So every mother should have antipyretic at home. Usually, the guide to the dose is written on the body. Like under 1 year, you can use that rough guide. Usually when the pediatrician sees, they will use the weight of the child to calculate. But when you're at home, you can just look at that rough guide. It's enough. Just use it. Give the paracetamol. When you give these 3 combinations, expose the child, tepid sponge, and give the antipyretic. These 3 actions in combination will usually bring the temperature down. But when it brings the temperature down, you don't sit down and relax and say, it's okay. Because remember, I said in the beginning, fever can be continuous and it can be intermittent. So the fact that it comes down doesn't mean that it's not going to rise again. Just wait for it. It will still go up. And who knows, it may go up again in the middle of the night when you cannot rush out from the house. So it is better that once you have done this, you head to the hospital. What do you expect from your health service provider when you get to the hospital? The first thing you expect is that the doctor will take history from you. The doctor will ask you certain questions about your child. These questions are questions that are likely to give the doctor a lead to the cause of the fever, because eventually it is the cause of the fever that will determine the kind of treatment that the doctor will use. Apart from questions to guide the doctor into the causes, doctor will also ask you some questions that will guide him into determining whether there are complications that are there. For example, when When was the last time that your child fed? When was the last time that this baby sucked? Sometimes mothers come to the hospital by 7 p.m. and they're telling you, this baby fed last since 7 o'clock in the morning. Then you know there's a problem. This child may be hypoglycemic. Some tell you the child has been sleeping. The child may not be sleeping. The child may be slipping into unconsciousness, but the parents think that the child is just...
Unfortunately, the child can't talk.
Unfortunately, the child can't talk, and that is why you must go to the hospital. Because unlike adults, Dr. Martina, when you're sick, you know when alarm don't blow.
Sure.
You know, but when it is a child, the child is not able to tell you. You just have to take the child to somebody who can interpret these signs better. What else do you expect from your health service provider? Your health service provider should be able to carry out some tests in order to determine the causes. The commonest test that they can do is what we call the malaria test. And now we have what we call rapid diagnostic test. It is a test that will just require a finger prick, and under less than 10 minutes, the result will be available, and the doctor can determine whether you're dealing with malaria or not malaria. There are other blood tests that can be done. And remember, like I said in the beginning, any doctor who sees your child immediately and sends you to go and do a typhoid test, please, you may just want to change your mind and go somewhere else, because the doctor is actually not going in the right direction. Wow. So these are some of the things. And then the doctor will now give your child some drugs, prescriptions, guided by the weight of the child. The doctor will also determine if your child requires to be admitted into the hospital or not. Some of the indications for admission in a child who is having a fever include a child who is not eating at all, not eating, not drinking, a child who is extremely weak, lethargic. The child cannot get up, the child cannot talk. Those are the things that require. Or a child who is also having breathing problems, suggesting a pneumonia, severe pneumonia, illnesses, convulsions. Those are some of the things that would...
Dr. Uzodinma, it's obvious we're going to bring you back to expatiate on some other areas that we're able to talk.
Exactly.
But I don't think I will let you go without sounding it as a warning for our parents out there, the complications of having a fever. For instance, there was this child that had a fever and had a convulsion. After the convulsion, by the time the child came around, she had lost the sight.
Yeah. Yeah, Dr. Martina, you know,
so
like I said...
the mother was just like, my child can't see.
Yeah.
My child can't see. Then I was still in the UBTH. And at the end of the day, the child
nothing
went blind.
could be done.
Yes.
Yeah.
From just the conversion.
Yeah.
So maybe when we come again, we'll do like a part 2 of this program.
Yeah.
We'll talk about the complications.
Yes.
And maybe we'll take it also with convulsions. It's actually very pathetic.
Yes.
When you see that these are things that are the mother did not even know.
Preventable.
Yeah, it's preventable. She didn't know. The next thing is that my child can't see. My child can't see. My child can't see, and that was it.
Yeah.
So we needed to explain to her what actually happened in the convulsion.
Yeah.
So thank you so much, Dr. Uzodinma, for coming on our program. It's always a thing of delight having you, because you are always reeling out and schooling us on a lot of things. And I'm sure our parents out there actually have benefited from what Dr. Uzodinma said. Every fever should be taken seriously. Especially for children, they can't speak. They can't speak, but you should be able to observe and take them to the hospital. As first aider at home, you can actually start with what she told us. Expose that child. Then use do tepi sponging. What was it, tepi sponging? Just take your little towel, put a lukewarm water, and put over the chest of the child. The truth is that when you do that, you'll be able to even feel the heat come out. When that is done, you do it, put it in water again and put it back on the child. Then you give an antipyretic, something that can bring down the temperature. That does not mean you should stay at home after doing all this. Take the child to your pediatrician. Not all doctors. Take the child to your pediatrician. And the child will be investigated and proper medication given to that child. So on this one, I want to say thank you so much again for being part of our program today in keeping up with the physicians. Same time next week, ensure you don't stay on your screen alone. Call families, call friends to always watch the physicians. And don't forget to follow us on our social platform, Instagram, Facebook, and of course, what else? The YouTube. We've had so many episodes on YouTube. Over 150 episodes actually there. Go and binge on them. Just go and binge on them. And if you have anything, just send us an email. My name still remains Dr. Martina Agberia. Till next time, stay blessed.